Hey guys, Dr. Clinton Coleman here from Recommended Daily Dose Podcast. Today, I'm going to be answering some important questions about the coronavirus and how it affects transplant patients. This is brought to you by Ment.org, a community for patients waiting or living with an organ transplant. And just to give you some background information, this new or novel strain of coronavirus, SARS-CoV-2, is from a family of common viruses that usually cause what we call the common cold. This novel strain can also cause a severe disease called COVID-19. Some of the symptoms we see include flu-like symptoms like fever, cough, and shortness of breath. Some patients who are either elderly or immunocompromised, including transplant recipients, may develop pneumonia, which, if severe enough, may lead to respiratory failure. And here are some important questions that you are asking. How can I prevent myself from getting the virus? The best way to prevent getting sick is to avoid being exposed to this virus. The virus is spread mainly from person-to-person close contact or respiratory droplets produced when an infected person coughs or sneezes. This is why it is extremely important to wash hands often, avoid touching your eyes, nose, and mouth with unwashed hands, avoid close contact with people who are sick, and clean and disinfect frequently touched surfaces daily. That includes tables, doorknobs, light switches, countertops, desks, phones, keyboards, toilets, faucets, sinks. You get the idea, right? Are transplant recipients at higher risk for COVID-19? We can assume that because other infections from viruses and bacteria often cause more severe disease in people whose immune system is low, that this may apply to COVID-19 and transplant patients. This is why prevention, including social distancing, is very important. Do symptoms show right away in a recipient? Also, how many symptoms should I have before getting tested? Symptoms may appear anywhere from 2 to 14 days after exposure and can range from mild symptoms to severe illness. Some warning signs that may require immediate medical attention include difficulty breathing, persistent pain or pressure in the chest, or severe fatigue. Please consult your medical provider or transplant team if any of these symptoms are present. Are there any travel restrictions for transplant patients? Yes. Again, please follow public health recommendations for social distancing. Stay home as much as possible. Avoid large crowds. Do not travel to areas with high amounts of circulating virus. And postpone non-essential travel, not only for you, the transplant patient, but for everyone else in the household. My concern is getting COVID-19 and losing my transplant. Could this occur? So currently, there's no data on how the virus affects transplant organs. We do know that in rare cases, COVID-19 can unfortunately lead to severe pneumonia, which may ultimately lead to multi-organ failure, and rarely, but unfortunately, can lead to death. Can I decrease my immunosuppressant medication to help prevent the virus? No, this is not recommended. You need to continue your transplant medications for the health of your organ. I do think it's important to check with your doctor to make sure your levels are therapeutic and that you're not over suppressing your immune system. I was starting my organ donor application. However, everything has changed, and now I'm unable to proceed with testing. If I were to get the virus, could I still donate the kidney? That's an excellent question. Donors are currently being screened for COVID-19 symptoms and exposure history. The American Society of Transplantation recommends that living donors who have been to high-risk areas or exposed to someone diagnosed or being evaluated for COVID-19 to postpone donation for 14 to 28 days. I would like to thank you guys for the opportunity to answer some of these important questions. For more information, please check out Ment.org. That's Mentorg. You can also see our entire episode of the coronavirus on our YouTube channel. As always, be well and stay safe.